Hey there, and welcome to Lunchtime Live with the Center, where we talk about important fertility-related topics to support and inform your journey. My name is Ami Choksi, and I am your host. Now, more and more women are delaying starting a family for a number of reasons, and one option to preserve your fertility that's relatively new and becoming very popular is egg freezing. So today, Dr. Andrea DiLuigi is talking to us all about egg freezing. Dr. DiLuigi is a lead physician at the center and an assistant professor of obstetrics and gynecology at UConn Health. She has also been with the center for over 15 years, and she sees patients mostly in our Hartford office. So, welcome, Dr. DiLuigi.
Hi, Ami. Thank you so much for hosting this.
Well, thank you for being here. Now, just yesterday, I read an article where Representative Alexandria Ocasio-Cortez, I hope I said it right, AOC, talked about egg freezing and some of the questions that were coming up for her. I think she was going to see her orthodontist, and her orthodontist was doing IVF. So AOC, she's around 30. She has an up-and-coming career, and she's focused on that. And she's wondering, should she freeze her eggs? So when someone comes to you, when a patient comes to you, how do you counsel them to help them make this decision?
Well, I mean, we talk about everything, and when we talk about where they are in their life in terms of planning for future childbearing, and if they're ready to be pregnant or not, because I think that's a really key question. For example, if someone is single and they come to us and they're thinking about egg freezing, but they're ready to be a mom right now, sometimes patients will choose a different path. They'll choose to proceed forward with donor sperm insemination and conceive and actually be pregnant and have a baby. So we kind of talk through the process. And I just want to mention, as you know, but viewers may not know, that talk is now via telemedicine because of COVID, which a lot of patients are finding to be more convenient. So we talk just like this, and we talk through the patient's history, what the patient wants and what she's ready for, and we review the medical history, and I try my best to give advice to the patient, and we plan for some testing. And then we work through it together and help the patient find the path that's right for her.
So what exactly, and maybe we should have started with this, what exactly is egg freezing?
Egg freezing, it can sound scary sometimes to patients when they hear about it, but it's actually not a bad process at all. And I know obviously I'm biased because this is what I do for a living, but it's honestly, in a nutshell, it's a 2-week commitment. It's taking medications for about 8 to 10, sometimes 12 days. And then having ultrasounds during that phase where you're on the medication and some blood work. And then scheduling a procedure called an egg retrieval, which is the procedure during which we remove the eggs from the ovaries. And there's no pain associated with it because patients are given medication. They take a brief nap for about 20 minutes. And we do this with an ultrasound machine in our procedure room. And then the lab counts the eggs, and we notify the patient about how many eggs she got, and then they get frozen that same day. So it's really not bad. It's a 2-week process, and I think for a lot of people, it's easier than they anticipated that it would be once they get started and feel comfortable with everything.
So, what are some of egg freezing versus typically versus embryo freezing? What is that?
So the key difference is the stage at which you freeze. So and this is very confusing to patients, and I'm sure some people in the audience are confused and don't know the terminology. So let's go through that. So an egg is an unfertilized cell, and they're in the ovaries of the woman. An embryo has been fertilized by sperm. So when patients come to us and they're thinking about fertility preservation, and I guess I should interject and just mention that one of the common requests that we've had recently is to freeze embryos. So, someone may have a partner, or they could be single and be using donor sperm, but they want to freeze embryos because they're not ready to be pregnant right now. And one of the concerns about pregnancy right now for some of our patients is the COVID-19 pandemic. So for people that are either in a relationship and have a partner, or if someone has chosen a sperm donor, they can freeze embryos. But for someone who wants to preserve fertility and is single, for example, and isn't ready to proceed forward down a different path where these eggs are fertilized by sperm, egg freezing is a good option. So, a common scenario that we'll see is maybe a single woman or a professional. We have same-sex couples that are concerned about the biological clock as well, but just not ready to physically be pregnant. And those women would be great candidates for egg freezing. And then in the future, those eggs, we can thaw the eggs and fertilize them with sperm, either from a partner or a sperm donor.
Okay. Now, when it comes to, so when you talk about biological clocks, so what age is best for this? How is there a specified age?
Well, I want to say that the earlier the better, and 35 is a big cutoff that people tend to use in medicine and reproductive age women in general. For example, a pregnancy in someone who's 35 or older is a higher risk pregnancy, and there's a higher risk of certain things happening in that pregnancy. For example, elevated blood pressure, diabetes, or increased risks of things like Down syndrome. But if we talk about the biology and the physiology there, what I can tell you and the viewers is that we have this really unfair double standard in nature where men can make new sperm every day, and we're born with a supply of eggs that have to last our reproductive years. So as we get older, our eggs get older, and we can't make new ones. So the eggs become less healthy as we age. And when they fertilize with sperm, they're more prone to making mistakes in the cell division process as we get older. And that's the main reason why the risk of abnormalities like Down syndrome go up with advancing maternal age, especially over age 35. And that's why pregnancy rates go down as well. So the younger a woman is when she freezes, the better the chances are of having a healthy pregnancy from those eggs. But honestly, every patient is different. We have patients that have different egg supplies at different ages. So although it is better in a sense to freeze when you're younger, just because of the health of the eggs, so less than 35, for example, I would say is an important number to keep in mind. It doesn't mean that someone can't freeze when they're over 35. We would talk to that patient about, different risks. Maybe we have a different goal in mind, for example, for the number of eggs as a woman gets older because of concerns about the health of the eggs. But take-home message is younger is better, but not everybody is ready when they're younger, and some people aren't aware of the technology when they're younger. So we've had people that have come to us and they've frozen at 38, or some candidates that were older that froze as well. So those are just some general guidelines.
And you said, so we're born with all the eggs we're going to have. So does it benefit someone who's younger because they have more eggs? Do you typically retrieve more eggs when a person is younger?
Yes. So patients that are younger typically have more eggs and will respond better to the medications that we use for this process. Having said that, we have different tests that we do to assess a woman's egg supply anyway, and we use those test results to help us come up with an appropriate medication dose for that patient. So, for example, if I have someone that is older or that has a lower egg supply and is younger, we will know that ahead of time so that we plan appropriately, and we're smart about how we approach the cycle, the dose of medication, and things like that. But you are right that younger women tend to have higher egg supplies and tend to respond better to the medicine.
You mentioned test. So is it a test that women can take with us or with their OB where they would know if there's a decline in egg supply?
Yeah, so we have tests that we offer. So say, for example, someone scheduled a consultation to learn more about this process. I would go over a list of certain tests that we could do to get more information about the patient's egg supply. So some of them are blood tests. So for example, one test is anti-Müllerian hormone, or AMH, and that is a hormone made by the tiny fluid-filled sacs in the ovaries called follicles that contain eggs. So the higher the number of AMH, the higher the egg supply. And that is a test that's available at many different labs. For example, like Quest Diagnostics runs that test. So sometimes patients come to us and they've never had that test. And sometimes patients have already had it done with their OBGYN.
Okay.
So that's a test that somebody could get elsewhere. They could ask their OB, for example, at an annual exam, can you order this test for me? But definitely that's something that we would offer. And then we do some more blood work on the second or third day of a patient's period, and that's checking FSH, LH, and the estrogen level, or estradiol, and that gives us information about egg supply as well, and kind of the function of the whole system. And then the other really great assessment that can be done is a pelvic ultrasound. So a transvaginal ultrasound, an internal ultrasound, it only takes a few minutes, and it gives us a really great evaluation of the ovaries. So the size and appearance of the ovaries, we can count the number of follicles that a patient has, and also look at the uterus as well, and make sure, for example, there are no cysts on the ovaries. But the big thing that we can get from that study is assessment of egg supply.
Okay. Is there an ideal number of eggs you want to retrieve at any point, or during after at a retrieval?
So for standard IVF, if someone is going through and they're trying to get pregnant, I would tell you that everybody's different, and there's variation, but on average, we see about 8 to 10 eggs in an IVF cycle. Now, when someone is freezing eggs and not doing IVF to get pregnant, for example, so say a patient comes to us and wants to preserve fertility and is not ready to be pregnant. If the goal is egg freezing, we try to be as aggressive as possible, but safe. We want the patient to feel well. We don't want any signs of hyperstimulation, but the goal is to get as many eggs as possible. So I try, and my partners here try as well, to minimize the number of times that someone has to do this. So plan ahead and give the patient the proper medication dose and monitor the patient very closely. It's really nice if we can get enough eggs in just one cycle, but it's possible that sometimes it takes more than one try to get enough eggs. So for example, if I see somebody that has a very low egg supply, that patient, when she goes to retrieval, will likely get fewer eggs than someone that has a high egg supply. And we know this ahead of time. We talk through it and plan and goals. For example, one of the things that goes into this decision making, aside from the age of the patient and her egg supply, is just how many children does the patient think she would want in the future, because that's really important. If someone is planning for one child versus 4 or 5, take that into consideration as well.
Okay. So this is an IVF cycle that they would be doing. Is it a
It's a half. You're correct in saying that it's IVF. It's the same process that we would go through to obtain eggs for fertilization for a patient that was trying to get pregnant. But it's a half of the cycle in a sense, because the commitment ends at the egg retrieval. So there's no medication after that. There are no additional steps to take. It's stimulating the ovaries to be able to retrieve those eggs, and then removing the eggs and freezing them.
And so where are they frozen? How are they frozen?
So they're frozen in our lab. So we have 4 offices, but our IVF lab is in our Farmington location, and we have a procedure room that is connected to our IVF lab. And our IVF lab is a very specialized environment. We have, for example, a special separate air filtration system to remove toxins from the air, and the lab air is ultra purified, which is really great for development of eggs and embryos. So lab is, and there's a little window that connects the lab to the procedure room. So as the physician is removing the eggs from the ovaries, the eggs are in these little tubes, and we're passing them to the specialized people that take care of the eggs and embryos in the lab, the embryologists. And then they count those eggs under the microscope, and then they freeze them. And the freezing process is really fascinating. I think we have some videos on our website about that too, about freezing. But the eggs are frozen in liquid nitrogen. So it's a very cold temperature. Cold temperatures stop the cell division process. So we are literally freezing time. And I mean, that's one thing that I thought we should talk about too, is just how does it stop the biological clock when you freeze eggs. And as I mentioned, as we age, unfortunately our eggs get older and the machinery inside the eggs becomes less efficient and less healthy, and it becomes more prone to errors. But if we take eggs and freeze them, we stop the clock, because the egg is just halted in time, and then when it gets thawed out, it's the same age that it was when it was frozen, which is pretty amazing. And I thank all the scientists that have come before us that have figured out how you can offer these services to patients. But it's pretty incredible.
That is fascinating. So is egg, when you thaw the egg, is that pretty easy to do? Is it, are there any, how effective is it in the thawing process?
The thawing process has really been perfected over time. So we've had changes. Sorry, I'm just getting a little pop-up on my screen about hand washing and masks. And I want to tell the viewers that I'm in a closed room right now with no one around, but I have a mask right next to me, and I've been wearing it all day. We're very compulsive about sterility and cleanliness here, especially in the midst of the pandemic. So anyway, I lost my train of thought from that pop-up.
How effective is it when? How effective is the?
Oh, yes. It's actually very effective. So like many things over time, science really helps us progress. And so, I mean, an analogous situation is embryo freezing. When people first started freezing embryos, there was a lot of trial and error, and protocols were perfected. And we've gone through the same process with egg freezing. So, the early pioneers of this process had some trouble freezing eggs, because eggs are very delicate, they're a single cell, and they're prone to ice crystal formation. So people figured out over time that you had to treat the eggs in a different way to freeze them, to keep them safe and protected. So now we have all of those protocols in place, and the thaw rates are very high, and frozen eggs do very well. And I would say that is a huge difference from where we were in science and medicine about 15 years ago, before all those protocols were perfected. But it's very exciting that we have this technology, and it took decades to perfect this process. We've been able to freeze eggs and sperm for eggs took longer to figure out, just because of the delicacy of the egg.
And so once they're stored, how long will they last in storage?
There's no expiration date, which is really great. But I would say that we have to keep the age of the woman in mind as well. For example, we wouldn't recommend having someone freeze in their 30s and come back to try to use the eggs when they're 60, because then there are other health and safety risks that we would have to keep in mind at that point. And there are a lot of risks as women get older when they try to get pregnant. So the bottom line is that there's really no expiration date. They stay safely frozen, and the clock stops. But we would encourage patients to come back to use them if they're planning to use them at a safe age. So most people do that before they're 50.
And one last question: is it painful? Is there any pain involved?
No, so it's so we have a really great anesthesia team here, and there are places that do egg retrievals with less medication, where the patient is, semi-awake, and we don't do that. And I always feel like if we have the technology, why not utilize it? So I always tell my patients that most patients have a great experience. They feel like they had a glass of wine or a margarita, and then they take a quick nap for like 15 to 20 minutes, and it's done. And patients don't need any pain medication to go home with. The medication is given through an IV, so it's IV sedation. It's very similar to what people have for procedures like colonoscopy.
Okay.
But most patients feel happy and they're comfortable and they don't have any issues at all. So it is a good experience for people. So to answer your question, no, there shouldn't be any pain after the egg retrieval.
And one more question this time. When someone is ready to come back and use those eggs, what happens? What would they do?
Yeah, so that part is it's pretty easy. We would just have a lab that the patient was ready to thaw the eggs, and we have consent forms for that. But the eggs stay safely frozen until the patient is ready to use them. So the lab would thaw the eggs and then fertilize them with sperm, either partner or donor sperm, and create embryos. And then from there, the patient would. So, for example, some people are planning to get pregnant right away, and we can coordinate with their cycle to thaw the eggs, fertilize them, and then do a transfer of an embryo in the same cycle. There's also an option to do genetic testing on embryos. Okay. So in that case, we would fertilize the eggs, develop them out to the embryo phase, and then the lab would remove a few cells from the placental area of the embryo and then send those to a genetics lab. And then within 1 to 2 weeks, we would have results. And that would be checking for things like Down syndrome and other chromosomal abnormalities. So then, once we get results in that type of situation, we would just plan to do the embryo transfer once we had those results back. And the embryo transfer is very easy. It feels like a pap smear. Mm-hmm. And there are different ways to coordinate that with based on a patient's menstrual cycle. But the process is very easy. So I would think of it as more legwork up front, but still not much. It's about a 2-week commitment in total. And then the second piece, most of that happens behind the scenes in the lab anyway.
Okay. And we have a question here where is asking about getting more information on egg freezing. What would someone do if they wanted more information?
We have some information on our website, and the American Society for Reproductive Medicine has some information on their website as well. But a lot of patients consider scheduling a consultation, a telemedicine visit with one of the physicians to talk about them specifically, their history and what they want, and guide them through the process. So those appointments are typically 60 minutes. I mean, they can be less if the patient doesn't want it to be 60 minutes, but you would have 60 minutes of physician time to go over everything and ask any questions that you wanted to ask, and then to just talk about statistics and lots of things go into the decision making on our end. So we would talk the patient through all of those things. For example, has she already had any egg supply tests or not? And if not, we would arrange for those things. But yeah, we would talk through all of those things. And then one of the things that I wanted to mention that comes up in these consults a lot, but for anybody that's viewing this, I think it's important for people to know this. I would say the number one question I get is, will this of eggs and will this process make me go through menopause faster? And the answer is definitely no. A lot of people are concerned about that, and I just want to explain because I think it's so important to know that. So going back to our double standard in physiology where we can't make new eggs, every month we have a group of those little fluid-filled sacs, the follicles, that are big enough to be seen on ultrasound, and they're in this little contest behind the scenes to be the chosen one. So our brain makes hormones, and the main hormone that we make is FSH, and the FSH sends the signal to the ovary, and one of those follicles with the egg inside gets chosen to grow, develop, and ovulate, and the rest get reabsorbed. Okay. So when someone is not doing any of this treatment, they're losing eggs every cycle. When we go through a cycle like this, the medications that we use are similar to the hormones that the body makes, and the main one is FSH. So when someone takes injectable FSH, it's at a higher dose than the brain would normally make, but what it does is it helps rescue all of those other follicles with the eggs that would be lost anyway that month. So it definitely does not accelerate the onset of menopause. It just rescues what would be lost that month anyway.
Good to know. So another question from the audience. My doctor recommends freezing embryos. Does it work the same way?
It's very similar. So if someone is freezing embryos, the difference would be, so the process would be very similar with, assessment ahead of time, a medication dose, blood work and ultrasound monitoring while you're on the medication, and then an egg retrieval. And then if it's egg freezing, the process stops there. The eggs would be frozen the same day as they were removed at the egg retrieval. If someone is freezing embryos, fertilization would happen that day. So the day the eggs are removed, they would be exposed to sperm, and the eggs would fertilize, and we would create embryos in the lab. So usually embryos are frozen at a stage called the blastocyst stage, which is when the embryo has already developed into a little baby and a placenta. And that happens around the 5th day of embryo development. So 5 days after the eggs are removed would be the most common day that embryos are frozen. But they do have a little bit longer than that. For example, the lab would check them the next day, and then up to the morning of the 7th day after the retrieval. But the process, yes, is very, very similar, but the difference would be fertilization with sperm versus no fertilization.
Oh, that's a good question. And then Kelly is asking, what are the odds that a woman will have a successful pregnancy using frozen eggs, and how does the mother's age affect her chances of a successful pregnancy?
That's a great question. So the success rates are the same. So let me back up a step and say, at a center or in a lab that has good experience with this, for example, like our center, who does a lot of IVF and a lot of egg freezing, the success rates for fresh and frozen eggs, or embryos that come from those eggs, I should say, are the same. The success think she should freeze to give her the best chances possible of having a successful pregnancy, because I mean, this is a little tricky to think through, but I want to just explain to any viewers that an egg is not the same as an embryo, and it's also not equal to a baby. And when we do this process, so for example, if a patient goes through in vitro fertilization, we retrieve several eggs, and the mature eggs can be fertilized by sperm, and then about 60 to 70% of mature eggs fertilize. And then there's a whole natural selection process. So Mother Nature protects us somewhat, where embryos that are not healthy are more likely to stop developing on their own in the lab than a healthy embryo would be. So there's typically some drop off. So I always say to patients, it's almost like this inverted pyramid effect, where you have X number of follicles, not every follicle will have a mature egg, and then it keeps getting narrower. Not every egg will fertilize or develop to a healthy embryo. So that's the thinking behind the recommendation of freezing multiple eggs, because the egg has to go through several stages. Whether it was frozen or not, it still has to go through those different and be a baby. So based on a woman's age, we would make recommendations on how many eggs to freeze. And there are a bunch of resources for this. We have a chart, like I have a chart hanging on my wall behind me that I can use to tell patients, for example, for people that are less than 35, if you bank 20 eggs, there'd be a 90% chance that you'd have a live birth. So things like that. We have calculators that you can plug in variables like how many children does the patient want, what is the age of the woman, and kind of guide someone in that way. So every patient is different and every situation is different, but we can talk through this with the patient to make the right plan for her.
Excellent. That, this has been really helpful. So we're coming to the top of the hour. Dr. DiLuigi, thank you so much for your time today. I really appreciate you being here and sharing. This is really helpful information.
Thank you, Ami. It went by so fast. I can't believe it. I could talk and talk and talk, but obviously I can't because it's time to go. So I will just say thank you. And to anybody who's viewing this, if you'd like any more information, feel free to check out our website. And you can always schedule a consultation to get some more personalized recommendations.
Someone is asking, is there a chart you're referring to that's available to look at?
I can get you the reference. It's from a research paper, but it's actually hanging right behind me. So, Ami, what is the best way we can do this? Can I scan it and email it to you? And you could.
I'll respond to Kelly and perhaps we can get it on our website or somehow we can get it to her.
Yeah, I have the research paper, but I have just the chart because that's the most important piece for counseling. And it's I have it right next to me, and I have it in electronic format as well. So, Ami, I can always email it to you.
Okay, perfect. All right, thank you again. We will be back next week with another Lunchtime Live. And be sure to check out our website at yukonfertility.com for additional information, as well as a calendar of events to support you and help you feel connected. So see you next time.
Thank you.